Hello again, guys. It's Dr. Reiter from Bentley Animal Hospital. We're getting ready here in pets, your dogs and cats especially. We'll be going over just routine maintenance, treating them, how to successfully treat them and flush them. And we'll go over a little bit about what I look for and what clients can do to prevent things or catch things early. So we'll be having Lauren, my technician, who helped us out on the last one. I want to thank her because I forgot last time. And the Gibson, the dog, will be with us, and then we'll also have a cat joining us also. So the first thing I wanted to start out with was just in general what we use to do routine maintenance. So I have a few products over here that I would say you need to have ready each time that you go. Flushing the ears as a preventative is very important. Some dogs need it more than others. All depends on the breed. So I usually have some Kleenexes, or if I have a larger breed dog, I'll use paper towels. And then I also have flush. So I use Q-tips for cleaning out the crevices of an ear. I'll also use my ear model to show you a few things today too. It's very important. The ear canals of a cat and a dog are very different than a human. Humans, their ear canal goes straight in. As you see this ear on this patient here, on this model, they have a vertical and then they have a horizontal canal. So it goes down and it goes over. And that's very important to understand when we're talking about pets, because everybody worries about treatment and how deep they go. They're worried about hurting the eardrum. As you can see, the eardrum is way down here. Any medications that we put in the ear, and I'll show you this again, we only go about that deep. But that's also where I get my samples, when I'm taking samples to view them on a microscope. And we'll show you guys all that today. So I will start out with the dog. We'll get Gibson up here and we'll show you just routine flushing correctly. And then I'll show you a couple of cytologies to show you the importance of why we do cytology on a pet. And it all helps us in the diagnosis, the treatment, to making sure we're doing proper treatment and making sure we're doing a complete treatment. Because some dogs, and cats, both, they have recurring ear infections. And we'll talk about that a little bit too also. But first I want to show you just routine care and just flushing the ear. So we'll start out. Switch sides. And again, I realize they're not all going to sit like this dog's going to sit. I usually do it with them standing up or sitting down, one of the two. But I will take our flush. We have two different sizes of bottles. I use the small ones for cats and little dogs, and I'll use the larger one just because it's more cost effective. You know, you get 4 times the amount of flush for double the price of something that's 4 ounce, and this is 16 ounce. So you get 4 times the amount. So the way I start, like I said, I get my stuff ready. And I know there's a lot of people that worry about Q-tips. I do not stick the Q-tips down in the canals. So all I do is use them to clean out the crevices. And that, when I say crevices, I'm talking these things. And I'm going to show you on the dog right now. So you can see on him, he's got a lot of crevices in here. And a lot of times you'll have, you can have an outer ear infection that affects just the outer ear. But then the inside, like I showed you on that model, it's very important that we understand that when we do that. Now, to get to their ear canal, their vertical ear canal, you can actually go down the side of the face, and when you go past the jawbone and you feel your fingers go into a almost like a crevice, you'll feel a little tube there. That is where you're going to rub when you're flushing. I don't just rub up top, I rub down here, and I rub vigorously, or about half your power. You're not going to hurt things. Their ears, right? They're very elastic, just like ours. The cartilage, you're not going to hurt it. So when you do the treatment or the flushing, the first thing to do is lift that ear up. Look at what it does. When I lift that up, it straightens that ear canal out, and you're going to fill the entire ear up with the fluid. So I'm going to show you that now. I take the medicine and I put it in the ear, and basically I fill it all the way up to the top. Then I'll take a towel, just so it doesn't run in the dog's eye or the cat's eye, and I'll rub down below. And I'm rubbing up and down, and you'll see the medicine, the fluid will actually slosh up. And a lot of times if there's a lot of debris, it will come up and you'll be able to just wipe it out. And I do that, and I look at it. You can see in this dog's ear, in Gibson's ear, there's not anything that came up at all, and that is normal. So in an animal's ear, if you're seeing a lot of wax in a cat or dog's ear, remember this. If you see it, there's a problem, and you need to contact your vet so they can give you medication. It is not normal to have any debris at all come up. So, and most of the time, what I do for routine flushing is we flush them about once a week, especially in those dogs or cats that have problems. And that's all based on learning the dog and learning the cat. And that takes time and communication with the veterinarian, and the veterinarian doing rechecks. Very, very important rechecks. If you get an ear infection, we treat them for a week, 2 weeks, whatever that time may be. But the most important thing is rechecking them. And we do that and we use a scope. So when we look down in the ear, this allows us to get in the ear. So when we flush the ear, you can see I wipe it out. If there's any debris in the crevices, I'll take my Q-tip just to finish the flushing program before I get too far. And then I'll just clean the ear out. And as you can see, I'm hardly getting anything. So that is normal. So that would tell me that he probably doesn't have anything going on. But as a veterinarian, we use scopes and we use it in the ear. But as you see, I go straight down. And that's how I look in the ear. And that's the same. And I look down and I look at the canal. I see it, what it looks like. Is it red? Is it pink? Is there a lot of debris? So his looks very good. So another thing we do, just to kind of go over ear infections, if a patient does have an ear infection, so there's about 4 things I look for in a cat or a dog. I look for odor. I look for if they're scratching their ears, and that'll be relayed to me by the client. Also, I'll look and see if there's a lot of debris. So that's 3. Another one, are they shaking their head? Are they having clinical signs, which means scratching their ear, rubbing their head on the ground, scratching at the ear? So those things will give it away. And if your pet is doing that, it needs to be looked at. Or if you're flushing them like I showed you, that's another thing. If you're getting a lot of debris, that ear needs to be looked at by a veterinarian. So, and a lot of times when they come into me, I use cytology. I'll take my Q-tip and I'll put it down that far in the ear, and I'll take that sample and I'll roll it on a slide. And when I roll it on a slide, I take it to the microscope and I look at it. The most common 2 things we see in there is bacteria and fungi. So, and it's very important for that veterinarian to do that, because when you come back 2 weeks later, how do I know if the ear infection's gone? Yes, it may look good, but I always use cytology to confirm that the infection is completely gone. That is the most important thing. Rechecks are very, very, very important. I can't tell you enough how many times people come in for an infection. I'll set up a recheck. 2 weeks later, they call and they say, I don't think the doctor needs to see it. But I've looked in these ears before, done cytology. My eyes think the infection's gone, but the cytology proves it differently. So we may go an extra week and then recheck the ear again. But that's kind of what we do. I'm going to take you to the microscope and just show you one that I've done, and you can see the fungus. Malaschisia is the fungi that you're about ready to see. So we're going to walk over to the microscope and I'm going to show you that. Grab the cat, please. So, like I said, we take the slide. I'm going to grab one here for you. So we'll take a slide and we'll put it on the microscope. Now I have a special microscope that has a screen here that also puts it up here so we can actually see the picture. This picture is taken, this is a dog's ear from 12/26 back in December. These are fungi. You can see them all over the microscope. That is not normal to see that many. So, and catching ear infections early are very important. When I look down in an ear and I see a lot of wax, but the owner says, my dog doesn't have an ear infection, my cat doesn't have an ear infection, they're not acting like the problem, that doesn't mean they don't need to be fixed or have medicine put in them. Because just like anything, if you start having an allergy early, but you deal with it early, if I can treat these ears early, I prevent pain, right? That's my job. My job as a veterinarian is to prevent pain, and that's what we do. But this here tells me, okay, I know exactly on this date what this dog came in for. And when I recheck this in 2 weeks, I'm going to do a cytology and I can compare it exactly to this. And sometimes I'll have a mixed infection. And sometimes I'll kill the fungi, but guess what? The bacteria is still there. Well, that comes to my mind thinking, okay, maybe we have a resistant infection. Maybe I need to use a different product. Maybe I need to culture the ear. So these are the things that we use. And this is a lot different than when 20 years ago, I never did these things. So again, just like the dentistry we talked about 3 weeks ago, we change. We know that we can prevent pain and make sure we come to a completion of no clinical signs, and meaning no bacteria, no fungi seen on our sample. And we look for ear mites, right? A lot of people hear about ear mites, but more often we see bacteria and fungus than we do ear mites. Ear mites are typically for new puppies, new kittens, or ones that have been, in the wild. They're spread, they crawl, they can't jump, they can't go from one animal to another very easy. So they're usually young animals or animals that just aren't well taken care of. So we're going to go back and we're going to take a look at the cat, show you the same thing in the kitten. Okay, this is Bruno. So Bruno's going to give us a hand today, and I'm going to kind of show you the same thing on a cat. Their anatomy of the ear is pretty much about the same. They got the horizontal and vertical ear canals the same. And when you're doing these, again, I'm going to repeat, make sure you grab the ear and you lift it up. You may have to have help. Not all of them are this good about doing this. So I'm going to grab our Kleenex, and I'm going to grab a little, and I'm going to show you the same thing. So I take this and I just fill it up. So, and it's pretty much filled all the way up to the top. And again, I'll rub in the same area, right below the ear, not up top, but down below the ear. And I do it vigorously, and I rub it. And then I'll take it and I'll wipe my Kleenex. And again, I look at it, nice and clean. So I'm not even going to use a Q-tip in this case because I don't see any debris. If you do, all you have to do is take it and just wipe a little bit. And I never lose my eye on the cotton. I always see it. I'm not pushing stuff down in the ear. And that's why it's important, if you use a Q-tip, you use it correctly. Don't put it down in the ear, please. So, medicating. I did not show you on Gibson how we put ear medication in the ear, but it's going to be the same way in a dog. So, this is probably one of the most important things. And we do this to all our clients when they have ear infections. So, application or applying your medication is one of the most important things, because if you're going to come back in 2 weeks, if I don't show you properly how to make sure to apply it, you're going to have an ear infection when you come back. So we always try to show our clients this. So you take the ear and it has this long tip, and it's going to go straight down like this. It does not go in like a person's. It goes straight down right here. That is very important. And it's very important we show you that. And then you never, and we squeeze it 3-4 times. It's always better to put more than not enough. So I apply the medication, I count to 10 or 15. I do that, and I lift this ear up because gravity is going to get it deeper, closer to the ear canal. And then you just rub the ear like this. And then you let them go. And they're going to shake, and that's okay. But you don't want to let them shake right away. You want to give it that 10 or 15 seconds to get deeper, right? Because a lot of these ear infections are deep here. And if I only apply the medication here, I want that gravity to get it deeper. But if you let a dog or cat shake right away, guess what? It's going on the wall or going on you, and it's not getting where you want it. And that's very important on the rechecks, because I want to make sure they do that right away. Now, also on the outer ear, if there's infection out here, you may have to apply some there. So every ear infection is a little bit different, but it all depends on what the veterinarian finds on their exam. So, other things. I'll take a few questions. That's about it. I've shown you on the dog and the cat how to flush the ears, what to look for if there's an ear infection. That's all very important. And if we find things early, if I can teach my clients, if I can teach people just to stop the pain, because ear infections are very, very painful. We all know that. I get them that they get so bad I have to sedate them to even clean them. I won't clean an ear if they're horrifically painful, because I think it's wrong. It's too painful. So sometimes we have to do that. But if I can teach you as a person, as an animal lover, to find it early, that's my goal. My goal is to reduce the pain, to catch it early. And if you listen to those clinical signs, if they're shaking their head, if you smell odor, if they're red, if they're rubbing their head on the ground, all those things, a lot of wax when you're flushing them, all those things matter. I'm going to go to cats a little bit. So cats are a little bit different. Reoccurring ear infections in a cat are very common also, and that can be caused because the cat had an ear mite infection and it caused some kind of inflammatory response. I've taken a year where I've had to have the owners flush every month and check periodically. So it's very important they get rechecked, because cats get just left in the dark and they get left alone and they just deal with it. And I believe that's wrong too. So, and then patients that have reoccurring ear infections, that's something you have to work with your vet with a lot, because Labradors have allergies, and if they keep getting fungal infections. So another reason why we do that cytology. If your patient comes in and they're having 3 or 4 times a year, I'm doing cytology, and they have fungi every time. Well, guess what? That's a symptom. You're treating a symptom. The ear infection is a symptom. It's not a causative thing. So you got to think in your mind, okay, why does my dog keep getting this ear infection? Why is my cat? So maybe I'll put it on a special food, a hypoallergenic food. Maybe that'll help. That's helped many of my patients. You know, maybe I have to do culture because we're not getting it completely gone. But allergies are another thing. Maybe he needs to have an allergy testing. You know, so there's so many different options that it leads you to, but it's important to just make sure that you understand that recurrent ear infections can be bad, and especially in the cat, So I'm going to take some questions now, because we've ran about 20 minutes. So if anybody has any questions they want to send to us, we'll answer those as best I can. So,
if a cat has wax, is it always an ear infection? Can they just have wax?
All right, so that's a good question. So cats are almost similar to dogs. So when I look in a normal cat's ear, it should be pretty much perfectly clean. The cats that I see that have these recurring excessive wax, I've done cytology on those, and yes, I will not find fungus or bacteria, but I've flushed those out, and I teach the clients how to flush, and I've medicated those ears, because when I clean them out, the walls will be almost bright red, inflamed, and not from me. It's underneath the wax. You look in there, it's dry. It looks, you know, hey, that's just flaky wax. No, it's not. You know, I've had veterinarians that work for me, younger veterinarians, that they say, oh, that's just dirt in the ears. And you know what I tell them? I tell them, take a swab of that, put it on a microscope, and you tell me it's just dirt. And most of the time, almost 90% of the time, you're going to find infections. But cats are different. Cats will have that dry, waxy buildup that may happen every single month, but I have to learn that. I have to learn your animal, but it's important that they do rechecks and clean them. So sometimes we just have to maintenance clean them on a cat, but medication doesn't hurt because it helps soothe it. But that's something you have to learn. But no, it is not normal for cats just to have wax in their ears. So hopefully that answers your question. Is there any other questions people may have on this? Any questions about the flushing, how I did it, or anything? Well, if there are no questions, I'm done for this period. If you do have questions come up, you guys think about, just ask on Facebook. We'll answer them. We'll try to do it. You know, or call our office at 636-225-4545. You know, if we can show you, my job is just to help. So,
are there any side effects to the medications?
Good question. So, side effects to the medication. So, yes, there can be. Punctured eardrums can also occur. And medication, if this medication gets down into the inner ear, it can definitely cause problems. Signs of let's say, toxic problems with the medication would be tilting of the head, walking in circles, loss of equilibrium, stumbling. So that is a sign of medication getting into the ear. And it can occur even without a punctured eardrum. And we don't know why. You know, it can happen in a cat or dog. I have it happen all the time. Loss of hearing is another one. So if your dog, you know, the owner goes, man, I don't think my dog's hearing so well after I've been putting medication in. That's something you need to stop the medication and contact your veterinarian right away. If you see them dizzy, tilt of the head, or just it looks like they just can't hear as well. So that's a very good question. But that's stuff we go over each time when we give out medication with our clients. So,
do you always just use a paper towel, or can you use cotton balls?
You can use cotton balls. I guess I just like a towel on my finger because I can kind of get deeper and try to get some of that the fluid out. The fluid that I use, this product that I use, it does have glycosilic acid and it has boric acid. So the boric acid and all those products, they help dry the ear out. So it's better than just using water, right? So it helps dry the ear out. It moisturizes the ear. It's specifically made for dogs and cats, but also the boric acid will actually be an antifungal, antibacterial, as in it helps your medicine kill better when you decrease the numbers, and it makes them more permeable to getting killed. So good question. But yes, I don't just use water and cotton balls were fine if that works for you. So,
How often do you need to flush a dog's ears?
I tell my clients once or twice a week, and these are on cases that just routine flushing. But I know when I tell somebody once a week, if they can do it once a month, that's great. The more you can do it, you're not hurting them. If you flush them once a week and they don't need it, it doesn't matter. You know, as long as it's not bothering them. Some animals need it more than often, like some cats don't need it at all. You know, we do it on a patient by patient basis. Those ones, like I said, the cats get the dry ear wax buildup. I'll have clients doing it once every week or two, you know, to help decrease that buildup. Because I have dogs the same way that'll have just a dry, waxy buildup. But if that doesn't go checked, right? If that goes unchecked, they're going to have a bacteria and a fungus build up in that ear. So preventative maintenance all depends on patient to patient. But if you're doing it once a week and you're actually looking at your animal's ears, and it gets people looking at them, so you can catch things early, and that's the goal. So, but very good questions. So if there is any other questions, thanks for your time. We'll do another one in a couple weeks, maybe on some arthritis or things. So thanks, Michaela, that's videoing for us too. I didn't thank her. So thank you, Michaela. Have a good night, fellas.